Hello everyone, today we are going to discuss economic evaluation of health programs. Our focus is basically on health programs. You have been in a situation where you have a given budget for implementation of health programs. You will need to have to choose which health program you will have to invest that money in. And therefore, you also need to have evidence for why you have chosen a particular health program. Economic evaluation is one of the tools that you can use to determine what health intervention you're going to be engaged in. So, economic evaluation is a type of cooperative analysis of the alternative course of actions that you could take considering the costs and consequences of the best alternative that you have chosen. So basically, you will look at the costs and the consequences of each of the health interventions. So we look at two major things, the costs and then the consequences. So when looking at the costs, we basically can look at it in two angles. Like how much do you spend on particular goods and services, that is the financial cost. And then the other cost that you can also look at is what you call the opportunity cost, which looks at the cost foregone if you have decided to buy one alternative. These costs can be direct or indirect. The indirect mean the costs that that are associated immediately with the particular intervention. So for example, what are the things that you're going to buy to be able to deliver health services, the consumables, or what you can call health supplies? You can also look at direct costs as in terms of the staff time that they will allocate into a given health program. And then on the other side, you can also look at the indirect costs which are associated with a particular health event. So for example, if someone falls sick of malaria, they will have to go to the hospital. That means that the day that they will spend in the hospital will be a day lost at work because they will not be actually productive, and that can be converted into costs. So, and we can call that indirect costs. Sometimes health problems cause us experiences which are not pleasant, and we can still quantify them in terms of costs. So we can call those intangible costs. And issues like pain, anxiety, these are examples of health states that happen because of particular disease. Another terminology perhaps that we can use is what you call health service costs. So for example, if someone contracts, let us say, typhoid, the cost of treatment can include the time that the health worker will spend on this patient, all the supplies used in testing and diagnosing the typhoid, the medical supplies will have to be included in the costs. And then if the person is going to be hospitalized, the bed on which they are going to sleep, the number of days in which they are going to be in the hospital, within the hospital setting, they will also use electricity, they will use water, they will use Wi-Fi, and other things. So these are also under expenses or health service costs. We can also look at this health services cost in terms of what the family of the patient will spend in making sure that the patient actually gets well. Okay, so they'll have to spend transport, they may have to buy food from the restaurant and issues like that. So those are also costs that can also be calculated during economic evaluation. The basis of economic evaluation is that we should be able to quantify things in terms of money, and we can use the market value, the prevailing market value, to determine some of these costs. But of course, sometimes it is very difficult to determine the costs of each and everything. And that's one of the challenges of economic evaluation. But we can also use the principle shadow pricing in determining the prices of things that we may not have the market value for. So the consequences of a particular health intervention, of course, the consequences can be benefits or it can be harm. So the benefits can be categorized into three categories. The immediate benefits. So for example, if the intervention is about screening people for high blood pressure, or the intervention is for providing chronic care to people with, for example, high blood pressure. If their blood pressures are high, you give treatment. The reduction in blood pressure can be an immediate benefit of the intervention. Sometimes it is very hard to like, for example, quantify these benefits. And we may use a generic term, utility, to quantify some of these. For example, well-being, happiness, and satisfaction, overall satisfaction of an individual about their own health. We can use different scales to determine that. Another third aspect is what we call QALY, which is quality adjusted life years. It's also another quantitative and qualitative parameter that we can use to determine the benefit of particular health interventions. So we carry out an economic evaluation with the thinking that we should maximize benefit, minimize input, but have a lot of output. So benefit can be what I've just explained, the direct improvement in life status or health outcomes. And then also, if people are healthy, then their productivity is going to be high. So a given health intervention can be determined to be beneficial if it also caters for the fact that it can increase productivity at work for different populations. So economic evaluation is a tool that can help us in allocating resources, determining where we can put these resources, what are the priorities, and then that if we make the decisions, we have evidence enough for why we have chosen or we have taken such decisions. It also enables transparency in determining the course of action. It helps us to critically look at the costs associated with particular interventions, and therefore we can say that economic evaluation is very important in budgeting. We have majorly three types of economic evaluations. We have the cost-effective analysis, we have cost-benefit analysis, and then also cost-utility analysis. We are going to look at each of these. Cost-effectiveness analysis, it basically compares the cost and effectiveness of health interventions. So we use it when we want to compare the cost and effectiveness of two interventions. We make a decision on which one to take. We often do this if the health outcomes are not the same for these two interventions. We basically use researched and published articles to generate information on which intervention is actually cost effective. Cost effectiveness is concerned with ensuring that there is technical efficiency, which basically means that we should do things right. So what you want to do is that you want to choose the best course of action in managing a particular condition. So you need to do things right. So which one offers the maximum benefit per unit cost? So you look at the benefit versus. We use what we call natural units in measurement of cost effectiveness. So these natural units, the number of given diseases that have been prevented from happening, the number of lives saved, and then also the quality adjusted life years. These are some of the parameters that we use in measuring effectiveness or what cost effective analysis. We can use the concept of incremental cost effectiveness ratio, which is that if you have two interventions intervention A and B, you want to see whether which of these two interventions will result into a lower incremental cost effectiveness ratio. This is to say that you have intervention A, the cost for intervention A minus the cost for intervention B divided by the effectiveness of intervention A minus the effectiveness of intervention B. And therefore, the emphasis with cost effectiveness ratio is that we need to have unit costs for the interventions. That value is actually very important because that unit cost has to be converted into monetary value. Usually we use the US dollar as the reference uh, uh, for quantifying the costs. In terms of US dollars, how much money have you used to save a life, for example? That is an example of the cost effectiveness ratio. The challenge with the cost effectiveness ratio is that even if you get a lower ratio, it does not necessarily mean that the other intervention that you have made the comparison with is actually more costly than the first one. It may only mean that the unit cost is the one which is lower, but it may not be effective in the longer run. So it means that when you're interpreting the cost effectiveness ratio, it's very important for you to realize that a lower ratio does not necessarily mean that the intervention is cost effective. Okay, it does not necessarily mean that. It only means that the cost per unit is lower, but overall, the cost effectiveness may not be interpreted that way. So we can use cost effectiveness analysis if we have a disease, a particular condition, and we are comparing the different modalities of treatment or the different ways of preventing that disease. So it helps decision makers to have a value for money, like a tool that can determine the value for the different interventions. The issue with the cost effectiveness analysis is that it may not take into account how the different populations within a particular community may benefit from one intervention. So it may not be very easy for us to make that judgment. Additionally, it's also very hard to know whether the intervention is actually affordable or not with a particular budget, because it looks at the cost of the intervention per health outcome that is actually desired. Another type of economic analysis or economic evaluation analysis is cost-benefit analysis. Cost-benefit analysis looks at the benefits and then the costs of health interventions. The goal is to make sure that the benefits actually justify the costs for the intervention. So you express this analysis using the cost-benefit ratio. So you look at the costs versus the benefits for an intervention. If the ratio is higher, then it means that the intervention is beneficial and can be carried out. If it is less, it means that the cost is higher than the benefit. And then if it is equal, then it means it is break even. Cost-benefit analysis values everything or expresses everything in terms of monetary value. And therefore, it becomes difficult to analyze things that may not necessarily be directly translated into monetary terms. But therefore, it looks at the direct costs and the indirect costs associated with a particular intervention. So we can use this benefit analysis in determining or in evaluating the benefits associated with large-scale public health interventions such as vaccination programs and infrastructure building. So it also provides very good information for the value of a particular intervention. The challenge is that we get difficulties interpreting everything in terms of money. So valuation becomes difficult for certain aspects. It also does not take into consideration the distribution of the benefits and costs across the different segments of the population. The last type of economic evaluation that we're going to look at is cost utility analysis. This actually compares the costs and benefits of different health interventions in terms of a common unit called QALY. We conduct a cost utility analysis to be able to determine the cost per benefit. Okay, so it gives us very good information on benefit per unit cost. What benefit do you get per unit cost in terms of dollars or other denominations? QALY is a parameter that we can use. It gives us information that is either qualitative and quantitative in nature. It helps us in determining what people feel about their own health and then also comparing it with the costs. QALY is a measure of health outcomes that combines both qualitative and quantitative aspects of life. The formula for determining QALY is the number of years gained by a particular intervention multiplied by a qualitative parameter, which often is given by the beneficiary of a particular intervention. It is a score of 0 to 1, 1 being the most perfect health and then 0 being death. So the higher the QALY, the better the health outcome reported. Incremental cost utility ratio is a parameter that we can use in expressing cost utility analysis. It basically looks at the difference in cost between two interventions divided by the QALY that they actually generate. So the cost of intervention A minus the cost of intervention B divided by the QALY gained by intervention A minus the QALY gained by intervention B. The interpretation is that if you have a lower ratio, it means that the intervention is more cost effective than the other. Usually, if you get a figure between 50,000 US dollars to 100,000 US dollars per QALY gained, then that intervention is actually effective. This value may vary from one country to another, but basically, if you have QALY which is less than 3 times the GDP of a given country, then that intervention is cost effective. So we can use cost utility analysis in comparing the different treatment modalities for chronic conditions such as hypertension or diabetes or heart disease, and determining which one can be used for health promotion and health prevention strategies. The limitation is still remains that it is very difficult to know how the benefits and the costs will be distributed in a particular population, and also there's a lot of subjectivity in quantifying the quality of life for one individual. So it creates uncertainty in the analysis. Overall, if you are to conduct an economic evaluation for any project, you have 6 steps that you can follow. You need to have the right question that you're asking yourself about the interventions, and then select the appropriate type of economic evaluation that you're going to use. You can determine the type of economic evaluation that you're going to use, and then now you can go forward to collect the data that you want about the intervention, and then do an analysis of the data, and then interpret the results, come up with the final report, and then communicate the findings to the relevant stakeholders for a decision to be taken whether to engage in the health program or not. So in this segment, the key things are that we have limited resources and we need to use them with care such that we maximize benefit. So economic evaluation allows us to achieve that goal such that we can be able to use the resources appropriately and that if we are able to do that, backed up with data, we are using evidence to make decisions. However, this may not be the only tool that you can use to decide whether you can engage in a project or not. And therefore, it has its own inherent limitations, as we have looked at. Thank you.